Paraphilic disorders. Paraphilic disorders, also known as paraphilias, refer to a group of mental disorders characterized by intense and persistent sexual interests, fantasies, or behaviors involving atypical objects, situations, or individuals. These interests and behaviors may cause distress or impairment to the individual or result in harm or the potential for harm to others. Here are some key points to understand about paraphilic disorders. Definition: paraphilic disorders involve recurrent, intense sexual fantasies, urges, or behaviors that involve non-human objects, non-consenting individuals, suffering or humiliation, or children or non-adult individuals. These fantasies or behaviors are typically outside of what is considered socially acceptable or culturally normative. Types of paraphilias. There are numerous types of paraphilias, including but not limited to exhibitionism, exposing one's genitals to others; voyeurism, observing others during sexual activities without their consent; fetishism, sexual fixation on objects or non-genital body parts; pedophilia, sexual attraction to prepubescent children; and sadomasochism, deriving sexual pleasure from giving or receiving pain. Diagnostic criteria. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association, outlines specific criteria for diagnosing paraphilic disorders. These criteria include the presence of intense and recurrent sexual fantasies, urges, or behaviors lasting for a period of at least 6 months, as well as distress or impairment caused by these fantasies or behaviors. Consent and harm. It is important to note that engaging in a paraphilic fantasy or behavior does not automatically indicate a paraphilic disorder. Consent, harm, and the ability to distinguish fantasy from reality are crucial factors in determining whether a paraphilia becomes a disorder. Non-consensual acts or those involving harm to oneself or others are considered problematic. Treatment. Paraphilic disorders can be challenging to treat, but various approaches may be employed. Psychotherapy, such as cognitive behavioral therapy, can help individuals manage their urges, develop healthier sexual behaviors, and address any underlying psychological issues. Medication, such as selective serotonin reuptake inhibitors, SSRIs, may also be prescribed to reduce obsessive-compulsive symptoms associated with some paraphilias. It's essential to approach the topic of paraphilic disorders with sensitivity and respect for all individuals involved. Professional help from mental health practitioners experienced in working with sexual disorders is recommended for diagnosis, treatment, and support.